righty. Well, welcome everyone. We are honored to have Dr. Gold today. She is the Chief Wellness Officer at the University of Tennessee System and the Associate Professor of Psychiatry at the University of Tennessee Health Science Center. This major leadership position encompasses 5 campuses across the state of Tennessee and includes over 59,000 students and close to 20,000 faculty and staff. She works clinically as an outpatient psychiatrist at Student Health and also writes in regular expert and media on mental health. She's been featured among other publications such as the New York Times, the Atlantic, NPR, which is my favorite, by the way, PBS NewsHour, and the Washington Post and Self. Her first book, How Do You Feel? One Doctor's Search for Humanity in Medicine, will be out in October 24 from Simon Elements. Dr. Gold is a graduate of the University of Pennsylvania with a BA and MS in anthropology and from the Yale School of Medicine, and completed her residency at Stanford University Department of Psychiatry, where she was chief president. So thank you for joining us today.
Thanks for having me. Hopefully I'll try to share my slides and figure out where they went. Why are you not showing up anymore? Let's find out. It's always the best made plans when you test them. Let's see, guys. You should be able to see this now, I think. Yeah. Hi, everybody. I have some slides, but if you want to jump in and ask questions along the way, you can. And if I see them, I see them. But otherwise, we have a good chunk of time at the end. I didn't do like a long bore you with slideshow situation. So hopefully it'll be interesting. I'm a psychiatrist who primarily sees healthcare workers. I'm currently based at the Health Science Center. So anybody who goes to school in a health related profession can see me as their psychiatrist. So that's like dentistry, nursing, PhDs, MDs, audiology, PTOT. I probably am forgetting someone and I feel bad. Nursing? Did I say nursing? Pharmacy. So I have a perspective from work, but also from my own experiences, like in training as an MD. And I am based on a big sort of college campus system. So also think a lot about what this is like pre-med school. And I don't think we talk about that enough. I think we spend a lot of time telling med students how to deal with their mental health and then telling residents and then telling faculty. We kind of forget about the fact that you guys aren't really fantastic either. So I'm hopefully in talking about some of this, talking about my career path, it'll be interesting and you'll be excited to learn more. So I start all talks. So if anyone's ever seen me talk, I start all talks with like making sure that people take a second to ask themselves how they're feeling. Part of it is because we're really bad at it and we spend a lot of time asking other people and don't ask ourselves, which shouldn't be surprising given sort of the empath nature of people who go into health professions. But I'm not particularly good at it either. So, because of that, I put it in my slides to force me to do it too. When I ask myself lately, I'm kind of here, which is like my mental health's great if I don't think about anything or I don't think about my mental health, right? I think a lot of us feel like that about mental health, which is like, it would be great if I didn't have to think about it, because if I have to think about feelings, like then I might not be able to go to work, or I might not be able to go to school, or I might not be able to do what I want to do. And so we kind of just power through. And that's like the way a lot of people, particularly in health professions, sort of deal. And the problem with that is it's sort of like a beach ball that you push down and eventually it'll whack you in the face. And so it's important that we make time to check in on ourselves, because it'll either come back bigger, we won't notice until it's quite big, or it makes us better at our jobs. To start this conversation, since I know career paths are also interesting to you guys, who am I? This is me as a baby. I look the same. At least I'd like to think I do, minus like some gray hairs and wrinkles. Like when you read my bio, you get the nerdiness of it, but I sort of want to give you a little bit of a thought process behind some of what I did. So when I was a pre-med, I did not like pre-med people or the classes because they stressed me out all the time. And I was always stressed out about it. And as a result, I became an anthropology major. Anthropology helped me sort of balance my classes. So I was doing some writing classes and some discussion-based classes and not just tests and competing in science and math. It also really helped me start thinking about the stories behind the people and the culture of medicine, which is a big thing I think a lot about in the work that I do. I took a year off before I went to med school, in part because I didn't want to take the MCAT my last year of med school, but also, or in my last year of undergrad, but also because as an anthropology major and really liking that, the logical overlap of like anthropology and health is to do global health. And so I wanted to be Paul Farmer. And so I basically took a year off trying to understand if that's really what I wanted to do. I worked in Switzerland at the World Health Organization as an intern for 6 weeks, tried to see what global health was like in that way and sort of global health policy. And then in my year off, I spent time in DC working at an adolescent health nonprofit. And it was right about the time that the Affordable Care Act was passing. And I was really interested in learning how government decisions and advocacy and policy can affect healthcare. I was particularly interested in adolescence because it's like a period of time where you're like not quite like on your own, but also maybe not on your parents' insurance anymore, depending. It obviously got extended to 26 now, but it wasn't really like that at the time. And so that was something a group that I thought a lot about and wanted to make sure had their own voices in the conversation. I went to med school. I was stressed out most of med school. I sometimes felt like I didn't really like get it or fit. I'm telling you this not to stress you out about it, but to normalize that feeling, I think. For me, when I was in med school, a lot of the rotations didn't fit, and the only one that really did was psych. And for me, that was because I liked patient stories and I liked having time with them. And I thought psych was really cool in that sense. And I also saw a lot of people in psych who did like weird jobs like I do, which is like a lot of things and not just like clinical care. And that was really appealing. And I went to Stanford and did psych residency there. My first job out of residency before my current one was to work at WashU. I worked as the psychiatrist on the college campus and then also really did a lot around healthcare worker mental health, particularly during COVID. Grew a clinic for faculty and staff, did all the outreach and education for our system for faculty and staff, and could definitely talk more about that if you have any interest. That has led me to my current job. I feel like people don't realize what Tennessee looks like or how big it is. So I started having this like talk slide that actually showed the like landmass of Tennessee. So I'm based in the little like Memphis Square over here. But the main campus that like if you watch sports and have seen the Tennessee Volunteers is over here. Then we've got these other ones in the middle. So we have Chattanooga, which is sort of in between in size. Martin, which is pretty small, and Southern, which is very small. But together, they make up about 59,000 students and about 19,000 faculty and staff. And in my job, I am like reporting to the system. So none of those people on any of the individual campuses like report to me. But my job is to basically be like, how do we center wellness as a value for all of the University of Tennessee? And what are people doing well that maybe the smaller schools need support to do? And what are people really all struggling with that getting in the same room and having conversations can make a difference and change that? So it's a lot of silo breaking, a lot of systems work, and a lot of like politicking in some capacity, because if people don't like you, they don't want to listen to what ideas you have. And so a lot of what I've been doing, I started in February for my first 6 months, has been like traveling and meeting people and getting to know what they're doing and how I can help. The other sort of like weird part of my job, which is maybe unique to some of the other folks that have talked to you or been in front of you. I started writing in med school as a way to kind of cope with stuff I was experiencing and seeing and big feelings. And that's led to a lot of writing. So I've been featured in a lot of places because of that. Most regularly, I tend to do sort of like traditionally women's magazines and did a regular bit in InStyle for a while. And I've been writing for Self since residency. And those are places where I tend to write. I do a lot around sort of things that I hear a lot of patients say that like could help other people by educating around them. I also do a lot of things around like the intersection of medicine and pop culture. So there are lots of times that mental health is mentioned on TV, but they don't go into it as in depth. And I have the ability to sort of be like, wait a second, like let's talk more about that and elaborate. Because of my writing and social media presence, I've been asked to be an expert on other places. So like TV media, like print media, radio, and podcasts. And if you have any interest in sort of like health advocacy using the media more broadly, I'm also happy to answer questions about that. I put the Selena Gomez picture because it's a flex, but I also think it's fun. So I've been on the Rare Beauty Mental Health Council for a couple years. The other people in this picture are also on that council. We basically just meet quarterly and help them with stuff that they're working on around mental health, because Selena talks a lot about mental health, and the foundation and the stuff that she's doing are very much related to that. And so I get to do that. And then I've also worked some with MTV on sort of mental health portrayals in the media and consulting on the work that they're doing. And mental health is a really good place for that, because there's a lot of storytelling and a lot of it is wrong and stigmatizing, and that prevents a lot of people from getting care. So I feel like in kind of working on all these platforms, I've been able to like help people one-on-one in the office, help people in my school system, but then help people kind of more broadly change the narrative around mental health, which has been really cool. The new sort of endeavor for me is this book thing. If you saw any of the posts and that's how you registered, I'm sure that you knew I wrote a book, because we're giving some away. There's a whole thing that he can tell you about that he wants you to do in order to get one. But inherently, the book is part memoir, part patient narrative, and really all the patients are healthcare workers. One of them is a pre-med. And it really looks at all the challenges taking care of yourself when your job is taking care of others, including for me as a psychiatrist. It's pretty personal, but I think that those are the best things. And the patients are all composites, meaning like kind of a couple people made up the one, but I think it tells our story pretty decently. It's out in like almost 2 weeks, which is nuts for me because I've been working on it for 3.5 years. This stuff that's not on my resume, because I think we should be whole people and not just people who went to a bunch of schools and work all the time. I don't have kids. I have 7 nieces and nephews because I'm the youngest of 4. This is Winnie. She's my dog. If you follow me on social, she's been dealing with some stuff lately, which has been kind of a thing behind everything I'm doing right now, but she's great. She's multi-poo. For fun, I'm a big fan of concerts and travel. This is a picture of us in London for Taylor Swift. I'm sure there's somebody watching who likes Taylor Swift and somebody who does not. And sorry for both of you, because there's a different feeling that gets evoked for me going to London from everyone. But back to business, now that you kind of have like a better sense of what I do and how I got here. I'm going to ask you guys, like, how do you actually define wellness? Type in the chat, I suppose, or if that's doable, if anyone feels comfortable doing that. Or Jubin, you can answer.
Yeah, the chat is open, so you can put stuff in there, but put your questions in Q&A so they don't get lost. I could start off. Wellness is taking care of yourself emotionally and physically, and making sure that you are content or happy where you are.
That's a good answer. I'm trying to find the chat. I don't know what I did with it. I sometimes make it go away. Oh, there it is. Balance of the good and the bad. Yep. Like in life in general. Maintaining a state of peace within and ensuring you have tools to use when things get rough. Yep. These are great definitions. No pressure. The reason I'm asking is what I'll tell you on the next kind of slide. It's a very like personal thing, despite the fact that it's in the title that I have, right? So it's kind of interesting. Currently the goal is actively not dying. I hope that means you're okay. That makes me slightly concerned, and we can talk about that later. But feeling fulfilled in life and equipped to take on its challenges when you're not in pain and suffering. Yep, all of these are great. So like I asked social media, this is kind of like a word vomit slide, right? But I asked social media, all kinds of social media, like how they define it, because I was taking on this job and it's like chief wellness officer. And I was like, what do people think when I walk in a room that I even do? And the answer is they have no idea, because these are all people's definitions and they're all different. I mean, there's things that are similar about them, but inherently they're all really different, right? Like if you have to define it, you don't have it. Like, right? Whatever that means. Holistic integration of physical, mental, and spiritual health, support to set up and keep boundaries, sense of vitality across multiple domains. We don't ever achieve wellness. There's no finish line. It's a constant endeavor. My favorite answer is this one that was like, after spending 5 minutes pondering, this seems like a Rorschach test. So I don't know how many of you even have heard of those, but those are like those things where they would like show ink blots and be like, what do you see? And then people just guess. And they were used in some old school kind of psychotherapy. And it was supposed to mean something about you based on what you saw. But I never learned that in training. And I guess you could, but I don't know much about it. But I think it's a funny answer because it basically means that the word means different things to different people. And the word can like conjure up lots of things. And I think that's a pretty good definition, honestly. But if you like think about it from the way that I think about it, there are like 8 domains. So when we talk about wellness, I think a lot of people think I mean mental wellness, and I do, because I'm a psychiatrist, but also mental wellness, physical wellness, financial wellness, spiritual wellness, occupational wellness, environmental wellness, right? These are all like domains in the definition from the Substance Abuse and Mental Health Administration. And that's the one I tend to use. It's just a little like maybe more in depth in that sense to make sure to cover all the domains, but I think it's pretty good. The other thing that I think a lot about that I don't think we do very well is I think about it on this like spectrum of like colors, but sort of like reactions to stressors. So this is a combat manual of like how they think about stress. I use it just to show you that like a lot of people, especially in healthcare, like you come to see me in like the red. That's like you've been sick for a while, you have a diagnosable mental health condition, but not everybody needs to get to the red. Like some people still will because brains and genetics and life, right? But some people probably could have paid attention earlier in like the yellow or orange to stuff that was going on with them and made a change or asked for help sooner and prevented being as bad as they were. So I think it's really important when you think about wellness that you think about it as like focusing on prevention, not only intervention. So medicine is really focusing a lot on intervention, like sick treatment, not how do we prevent a lot of people from being sick. And we need to be better at how do we prevent a lot of people from being sick. When you think about wellness as a pre-med, pre-health student, I really think about it as really key to understanding yourself, but also like surviving the whole process. If you don't find ways to prioritize yourself, there's like all these other steps and it keeps going. For me, I just put some data in here for you, not to scare you, but just so you're aware. For people in college, it's a prime time for mental illness, age-wise, biology-wise, but also sort of like just identity stressor-wise, right? So you go to college, maybe you've never lived away from home before. Maybe that's good and you wanted to be away from home. Maybe it's hard. It might be the first time you've like had a roommate, or that you've like not really had alone time, because there's people everywhere all the time, including in the bathrooms, right? Maybe it is the first time you've experimented with substances. Maybe it's the first time you questioned your sexuality, right? Like there's all these things that happen in college, which is great about college. But I also think it leads to a lot of stressors. If you look at the data, this is just these are from Active Minds. 39% of students in college experience a significant, meaning affects their life day-to-day mental health issues. But if you look at this, half begin by age 14, but 75% by age 24. So we're getting like another 25% in college. And then 67% of people who have anxiety or depression in that age group don't seek treatment. And this isn't like old data, right? So I have a lot of people who are college students who are like, we talk about mental health all the time now and like we love it and whatever. But for some reason, like being more comfortable talking about it hasn't actually led people to get more help or come get help sooner for it. I don't know what that is. I think sometimes maybe that we rely on other people like friends and family and assume that's okay until it's not, which is sometimes okay if those people can handle it. But sometimes you need meds or sometimes you need a different intervention and then it wouldn't be. If you look at just pre-meds, there's not a ton of studies on it, which I think is kind of sad because I do think it's an important time period to be like considering and thinking about. In this study, so pre-med students were found to have greater burnout scores in a dimension called emotional exhaustion. There are 3 dimensions. We'll talk about that in a second, but emotional exhaustion is like at the end of the day, you're just like spent and you've got nothing left. And that is higher in people who are in pre-med than in non-pre-med, even if you take out basically how depressed they also are, right? So it's not about depression, it's about burnout. Burnout, besides emotional exhaustion, is these other 2 things. So I think we use burnout like we use a lot of mental health words, like kind of in a sexy way, right? Like I'm anxious, but I don't have anxiety disorder. I'm sad, but I'm not actually depressed. Or like I work is hard, so I'm burnt out. We just like overuse them colloquially, but don't necessarily mean the diagnosis. And so when we're talking about it from a perspective like research or a perspective like what I would think about with it, it's emotional exhaustion, which I mentioned, plus depersonalization, which is that thing that like we actually teach people in healthcare to do to not feel like that all the things that patients are telling them are affecting them. It's like disconnecting a bit. And that, but it's like disconnecting a bit all the time, like every person, everything. Sometimes people also use the word cynicism for that symptom, which can be like just being really, really angry in a lot of settings. And the last one is a reduced sense of personal accomplishment. To me, that's the one that people notice because it's like someone's pointed out you're not doing as much, or you feel like you're not doing as much. And both of those things butt up against sort of overachieving perfectionism, which is like a prime quality in this population. Across the board in healthcare, we're around 50% for burnout, and most populations are much less, even people with like age match, but also school match, like same length of school kind of thing. Another way to think about burnout is it's an expectation mismatch, like what you think work is going to be and what it actually is. Like you might think that being a pre-med means you get to start seeing like patients in shadowing, but you probably do that for like 3% of your time. And like 97 is studying and like competition in school. And like that difference between where you might get meaning and where you might be like actually feeling connected and what it actually is where people get a lot of burnout. Importantly, burnout is workplace associated. Your workplace, if you're in school, is school. If your workplace in healthcare is going to be whatever workplace you're in at that time. It's not a diagnosable mental health condition as a result. So the World Health Organization classifies it as an occupational phenomenon. Some people would consider it an occupational hazard. But really, if you came to see me, there are codes for it, but not in what psychiatrists use for diagnoses. So we use this manual called the DSM, which like psychiatrists make on their own and have their own diagnoses in with criteria and lengths of time and all that stuff. And burnout is not considered a psychiatric illness. It's considered a workplace one. So just helpful to know that it's not depression, but it's very correlated to depression, which you'll see in these numbers. So this, I think, is an interesting study, which is that they found people with depression and higher levels of burnout had reduced interest in being in medicine, right? So if you're in pre-med and you are studying and you are getting sad or burning out, you're gonna not be as interested in doing the path or being in medicine. That's important because we should be preventing that so you stay in, so the best people stay in, right? And that was like those associations remain significant even when you controlled for like socio-demographic characteristics and like your own prior academic achievement. Another thing that's kind of important, I think, about in your population is the idea of perfectionism. So there's like an adaptive and a maladaptive type. Some people, the adaptive type is like, I really want to be the best, but I know that I will make mistakes sometimes and that's okay and I'll learn from them. The maladaptive type is like, I will never make mistakes. People who are good at their jobs do not make mistakes. And that sort of mentality makes it so when you do make a mistake or something, you have higher rates of burnout and depression and stuff like that. So like kind of conceptually knowing that it's a risk, knowing that it's something you need to like incorporate into your life early on, like how can you start thinking about this? So part of the reason I talked about the how are you bit and had you kind of check in on yourself at the beginning is that like we are so bad at that. And if we check in on ourselves, that little like scale of colors that I mentioned, you would be able to notice much earlier that you were having things wrong. So noticing warning signs in how your mood is, what your interest is. So when we use things, when we say loss of pleasure, we just mean that like you liked running and now when you run, you're like, I ran, yay, right? Or like you read a book and you usually like reading books and you're just kind of going through the motions of reading books, just don't get the same out of it. Lots of fatigue. So burnout in me looked like every day after work, I fell asleep and I would wake up and not remember I went to bed because I wasn't intending to because I was on the couch. And so that was a big thing for me. Social withdrawal. So emotional exhaustion can make you withdraw socially. Depression can make you withdraw socially. But if you're sort of like feeling not great, being around others doesn't feel like it would be helpful, but it's actually the opposite. We just don't approach things that way. Change in concentration. So if you watch TikTok, it will tell you anyone who has a change in concentration has ADHD. Some people do, but not everyone. It could also be anxiety. It could also be depression. It could also be sleep, right? Anger and irritability. So big for me in burnout is to be angry. I don't think a lot of people pay attention to anger as much. They are like, I'm not sad. I'm not worried. We're good, right? And anger is like a really important thing to pay attention to. I think also turning to substances is something to pay attention to. There will be experimentation, but it's more like frequency, time of day, increasing amounts, and sleep, huge too. When are they a problem? So I like this cartoon because I think this is what we do. But they're mostly a problem when they start to impair functioning. When I talk to college students, a lot of the time they say, oh, I'm totally fine. My grades are good. And then I say, well, what's going on in the rest of your life? And they're like, well, I haven't left my room. I don't feel like hanging out with people. I'm getting takeout, but my grades are good. So I'm good. That measure of like what counts as good is only in grades is not great. It helps you get all the way to the red when you actually ask for help because a lot of us can do school even when we don't feel good. And so paying attention to all aspects of your life, not just school, is really important in the functional assessment. Length of time, super important too. Is it getting worse? Also super important. Another thing that I think that we do wrong is we tend to be like, here's some skills, just do those and you'll be good. We do that a lot with things like mindfulness. We like teach it to people, tell them that's the answer and go on with your lives. For me, I've felt like I've had patients come and say that they're bad at coping when they do this stuff. Like it's almost like they learn that if I don't like mindfulness, if I can't stick with mindfulness, I must just not be good at this. And that's not helpful. I think with coping skills, the way I talk to patients about it, the way I'd love you to think about it is more like a hobby. Like what actually will you do and what works for you? So on that sort of like color scale in yellow and orange, these kind of things can be really helpful. In red, if somebody tells you to deep breathe or do yoga, you'll probably want to punch them in the face because I feel like I've been there and most people I give lectures to a lot of times are there. But if you're in the earlier stages, these kind of things can make a big difference and can be really helpful to incorporate into your life. But I think it really depends like on you, what you will do and what you like to do. I asked a bunch of healthcare workers on social like what they did. And the other thing I want to point out is most of what they're doing is not taking a long amount of time. So they're like saying something when they're walking the stairs of the hospital or going in and out of room with the gelling their hands, like washing their hands. They're not doing like an hour, 2 hour thing every day. They're refocusing on themselves in moments where they can. And that's helpful, right? So it doesn't have to be these huge things. It just has to be something you'll do and something you can do. Another thing that can be really helpful against burnout is meaning and purpose. I always think it sounds like very vague and woo-woo in sort of a philosophical way. Like, what does it mean to have meaning and purpose? But it's really like, what are you good at and why are you doing it? You can think about like what your strengths are. I'm really good at this. When I do this, I feel energized. I feel excited. The same for like different times of your day. So we tend to be like, Mondays are horrible. But it might just not be that Mondays are horrible. It might be Monday at 10 a.m. and that class. You actually hate that class, right? But we don't ever tend to like really specifically kind of like drill down on what we're experiencing. And I think it can be helpful because it could tell us like, okay, that class always takes a lot out of me. So right after I need like a 10 to 15-minute break of decompression, right? Or anywhere you can have control in that, moving a class, dropping if you can. Probably can't drop all the pre-med ones if you want to do it, but other classes. For me, it was like, this class is going to drain me. This class is going to give me energy. I need both in order to feel good. And then mission being sort of like what gets you out of bed in the morning. So like you want to do this for a reason. When you're younger and you're in classes that feel super disconnected from that reason, sometimes you need to shadow or do things like that to remind yourself like there is like a way in which this turns into something different. Part of the thing I think is really important when you're thinking about like meaning and purpose and training is, for some reason they try to tell you that like if you aren't sure or if you're questioning it, like you probably shouldn't do it. And I think the exact opposite. I think it's so healthy to take time to figure out what you like and actually question it, to do other fields and other classes and see if you like them. It's a long path. And what I'll notice a lot of times is like I'll see a resident as a patient and they never took time ever to ask themselves why they're doing it or what they like about it, right? Because you don't have that time because there's so many requirements, but it's really healthy to take that time and answer it. Like for me, my dad was a doctor and I was like, oh, good people who are good at science become doctors. But like inherently, maybe when I was in med school, like halfway through, I was like, did I choose to do this or did my parents? Right. And I think it's important that I ask that question too. I think in folks that don't have parents in medicine or don't even have parents who went to college, it could be more like, this is what I'm doing because it's a good way to have stability and money and support for my family. It's seen as a field with prestige and importance in my family, and I have no choice but to do it. And there's probably some kernels of truth in that, but I also just like challenge you to like take a step and ask yourself why and question it and know that's healthy. Also know that like sometimes people tell you you're like not medicine enough to apply. Like for me as an anthropology major, they would be like, it doesn't really seem like you like medicine. And I'd be like, well, a lot of my classes are like global health or public health. So I do like health. And they didn't really know what to do with that. I think they're a little better with this, but just know that like you can have other interests and still be a doctor. I do that all the time in my job, right? So like don't let people tell you that like there's a select algorithm, and if you don't perfectly meet the algorithm, you're not going to find a place, because there are places for everybody. Another kind of cool thing in this like meaning and purpose route is this concept of 3 good things. So daily before bed, there's this text program, and they just are like, what were the good things about your day? And if you just text back for 15 days, the data shows that people have improvement in emotional exhaustion. So like burnout, depression, and happiness, not just at 1 month, not just at 6 months, but at 12 months, right? For all they did was text back for 15 days. I know you guys use your phones to text. So this is very easy, and it's a very like good intervention. The reason why it helps is evolutionarily, our brains are designed to only remember the bad thing. If you went out on a hunt or whatever, gathering, and you ate a berry and the berry made you sick, you should remember that the berry ate you sick and like made you sick, so you don't eat the berry again, right? So our brains are like, there's berries everywhere, right? And so that's all well and good, except there are berries everywhere, and we have to remember that there are also like something that we ate that didn't make us sick, right? And so you kind of have to retrain your brain out of that. You know, if you're not a person who would want to do a text program, which is all based here with the QR code and it can take you here, and they made all these for people in healthcare, they're wonderful. But if you're not a person who likes that kind of like structure, take a journal, write it down. If you're a person who thinks it's like too fluffy to have three good things, you could do a rose and a thorn or something, right? And like give yourself some space to be angry and frustrated about the harder thing, but also like the good thing. I also tend to like keep things that people say that are nice to me in a box, and I go to that when I'm having a bad day. So like sometimes when you're really bogged down with patients and stuff, it can be hard to remember that you help people. And so I keep things like thank you notes or whatever in that box, and I'll go when I feel like I need it for that reason. And I think it can be helpful in sort of a gratitude way too, or to reconnect with meaning. Um, I think it's important too to think about the fact that college students care a lot about the world, and the world is really, really messy. And if you kind of look at this, like, this is a study called Stress in America from the American Psychological Association. Like 64% of people said their results were under attack, obviously different by group. If you care a lot about the world, it can be hard to turn that off, and that can hurt your mental health as well, right? Because you're like, there's so much going on in the world, and that makes me sad because I can't control it. But, you know, in that sense, like this concept can be really helpful, which is like the serenity prayer. They use it in Alcoholics Anonymous, but I think it's really helpful in a lot of things, because really it's just like what are the things that I'm stressed out about or concerned about that I can change, and what are the things that I can't, and I'm going to focus on the ones that I can. So basically you can kind of go like, here are the things I'm concerned about, and you can literally be like the world, the climate, like whatever, right? But you could also be like my feelings, my friend, whatever, these things that maybe you have a little more control over, and then just kind of put the other ones aside for a second and try to feel like you can get some of the other ones out of being stressors, and that can make a big difference. Another way to kind of think about this is like having the ability to give yourself some limits around social. I think that from my experience, people go like too far in either direction, and there's this belief that like social media is all bad or all good, and the data doesn't say that. The data says sometimes it's bad for your mental health and sometimes it's good, right? And what that means to me is like scrolling has purpose. However, if you're scrolling and you're grinding your teeth, you're feeling more angry, you're feeling more sad, take a break, but you have to pay attention. I think what a lot of us tend to do is just kind of like scroll without paying attention to ourselves in that surrounding. And that's really, really important to not just do that, because you will just keep scrolling and not realize it's making you sad. Same with around sleep. I try to not do it right before bed if I can, and spend like 30 minutes reading a book or something instead, because it doesn't do good things to sleep. It's hard to do this. It's something you have to kind of train into yourself, but I'm not saying you can't be on social, because I also think, or read the news where it's also stressful, but you just need limits around it, especially if you're kind of trying to pay attention to your mental health. Because inherently, like, I'm a big like advocacy is essential to being in healthcare. We need to know what's going on in the world to help patients because it affects them. I'm a psychiatrist. Everything going on in the world affects people's mental health. If I didn't read the news, I couldn't know enough to help them. But I also know in the back of my head that people used to watch TV for 30 minutes a day and get the news that way. And so having news all the time doesn't matter. It's more stressful, you know? Another thing to sort of think about beyond sort of like how do you take care of you is how do you take care of the other people around you. So like social support, without a doubt, in college students, in pre-meds, in healthcare workers, is like, besides meaning and purpose, the answer to prevention of burnout, but also support around like depression and things like that. People, the most common question I get, besides like something about diagnoses probably, is like, how do you support other people? It's hard to do that because if you have a friend that's struggling and you don't really know what to say and you never dealt with mental health stuff yourself, it just feels really hard. My suggestion is to try as much as possible to just be curious and supportive, not making any sort of assumptions. So the thing we tend to do pretty badly in a workplace is go, hey, Jessi, I noticed that you haven't turned in any of your things on time. What's wrong with you? Right. And as a result, like I will shut down or get defensive. I will not feel supported by that, even if the person inherently was asking because they were concerned, right? And it's really important not to lead with that and instead to be like, hey, like I've noted, like I'm a little like I would like to know more about what you've been going through lately. Can we talk about it? You know, and these kind of bigger things. Or if someone mentions they're struggling, kind of taking that bait and being like, tell me more about what that means, instead of like, I struggle too. Here's how, right? When we talk about normalizing experiences, so self-disclosure breeds self-disclosure. So if I tell you I'm having a hard day, you're more likely to then tell me about what's going on with you. So if you have a friend you're concerned about, sometimes it can be helpful to get them to talking, to be like, this week's been really hard for me. What's it been like for you? Right? Or I don't think they talk enough about how hard that biology test was. Like, can we talk about that and see what happens, right? I know a lot of you are much better at this than my generation, and for sure the generation above me, but sometimes it can still be really hard. The other thing to pay attention to is like, we really want to problem solve. Like we want to say, you have problem, I fix problem. But it doesn't always help. Even as a psychiatrist, I've had to remind myself that just listening can sometimes be what people need and want. And so paying attention to not just jumping right into a solution when you're talking to someone can make a difference. If you're a person who can't do that, saying to your friend, like, hey, do you want me to problem solve or do you want me to listen at the beginning of the conversation can be helpful. But it does also help to know what resources exist on your campus for yourself. Because if your friend then says, no, I do want help, like you can help them by knowing where to take them, because a lot of things in mental health especially prevent you from being able to take the step to make an appointment or track down an appointment. But if a friend can like kind of help you and make sure and walk you through it, it can feel a lot safer and it might get done actually. In other words, like I'm a pretty big fan of vulnerability. I use the word a lot, even though I think it's really scary for people to be vulnerable, because it really just means like you're putting yourself out there and people might not really understand why. There's emotional exposure in it, there's risk in it. But when you're vulnerable, other people are vulnerable. When you're vulnerable, it creates a culture that is more open and supportive, which we don't tend to have and we need. People who are vulnerable are seen as more courageous and empathetic, which is important for being a leader. But also, like, you can't be creative if you're not vulnerable, right? So to be vulnerable is inherently to be open to failing. And people who are creative are more open to failing because you just like try stuff and see what works. People who don't want to fail are going to try the safer stuff all the time because they'll be more likely not to. And so it can be pretty powerful in sort of culture change, but it can be pretty powerful in giving you space and time and energy to explore and do the things that you like to do. I'm also just going to say that, like, for some reason, we do wait until the red until we ask for help, but we also think that, like, if you went earlier, we're somehow going to turn you away. Yes, the mental health system is broken. Also happy to talk about that. But if you have access, your campus has access, there's really like no wrong time to ask for help. If you need help, like you should ask for help and feel okay doing that. I also think it's important to contextualize help, especially things like psychotherapy, as something that makes you better at school and your job. For some reason, we view it like I have a problem and so I have to go to therapy and then they have to fix that problem. But for me, I go every week. I've gone every week since, well, I mean, I went in college towards the end. I went in summer med school, residency every week, and in jobs almost every week. And for me, I'm not in an active crisis. That's not why I'm going. I'm going to be better at a better leader, better to myself, understand myself better. This is a quote from Carl Jung. So people in psychiatry have long been had thoughts about how our feelings about patients, about the work impact the work. And he said, knowing your own darkness is the best way of dealing with the darkness of other people, which just inherently means if you know you can be better for other people and what they're dealing with, because you'll understand why it's bothering you, why a patient might be hard for you, why you might be reacting to something they said, but also you might understand yourself and what you went through. And if they have similar stuff, you might also be able to apply that to them, right? So there's a lot you can get out of self-exploration, which I would highly suggest starting in college, that you don't get like just waiting until you have a problem that needs fixing. I'm like here for questions. That was just like my beginning of sort of like an attempt to have this conversation. I really like this quote um, because I think it's realistic and I don't think we always are. I think we think if I'm really good at school, like I won't burn out and I'll have all A's and that'll be that. But I think I've learned to approach life like our lives are challenging and sometimes we will burn out and that's okay. And this quote is pretty good at that, which is like the expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet, right? So our jobs are water. The things we care about in the world are water. Pretending they're not isn't helping us, but finding ways to grab an umbrella would be the way to survive, right? And so I leave you with sort of that thought, which is like planning and preparing and being able to take care of yourself in contexts that are hard will make it easier for you to do that, like in steps moving forward and all the other phases of this fun, exciting process that you have in front of you. Questions? Anybody? Bueller, Jubin?
I don't have any questions. Um, there's one question.
Oh, I can find it. Okay. How do you?
This the question is, how did you know you wanted to go to medical school? I was also wondering if there's a reason to go into medical school to become a psychiatrist over becoming a therapist with a master's degree, or someone who wants to go in the mental health field.
Good question. So I told you I had like a medical family. So I always in my head kind of thought I was going to be a doctor. I didn't know I was going to be a psychiatrist before I wanted to be a doctor. So I think if I did, I would have looked more thoroughly at the other fields and tried to understand why you would do one or the other. But, for me, becoming a doctor, I didn't have like a light bulb moment, but I think it was like the best place for somebody like me who liked people's stories, who cared about humans and wanted to help them, who was also overachieving and good at science. And that's where I ended up. I found psychiatry a bit later. Honestly, when my dad is a psychiatrist, so I tried not to be a psychiatrist, and that there's lots of reasons behind that, but I think that probably made the question you're asking about other mental health fields less relevant to me because when I went to med school, I was like, absolutely not. And then I ended up feeling like I fit there so much more. Sometimes I wonder if I would be like happy just as, like having gone to a PhD program or a master's program in mental health. I think it depends what you want to do. So mental health, like what people call themselves therapists, is a very broad range of degrees and people. On the MD medical side, what I am as a psychiatrist, I go through the same med school training as anyone else, like all the people who are surgeons. I then just do psychiatry residency, which is 4 years, but we have some medicine and neurology in that. If you are interested in the intersection between medicine and mental health, that's a logical place for it because we see people who have, we basically rule out all the other stuff because we understand it and we were trained in it and we're not just focused on mental health. We're also the only group that can prescribe medication. So we can do therapy. We have like pretty robust psychotherapy training, less than someone in a PhD program, but we really do focus on like learning all the meds and how to prescribe the meds. You'll see psychiatrists in inpatient units because of severity, right? So we're more trained in that. You'll see psychiatrists on consults in the hospital a lot for that too. So if like somebody's on a medical or surgical floor and they're having psychiatric symptoms, like we can help with that because we understand the medicine and the mental health side. So that can be interesting. If you know that like what you want to do is talk to patients and help them with their problems, you don't care about medicine, like prescribing medicine, and you don't care about the medical school bit, and you like are totally fine with like um having a background that's like exclusively mental health and you know that now, I would like very thoughtfully look at the other options. They vary by year, they vary by focus, but they're all pretty cool in different ways.
I
Yeah.
think the only thing that I would add is like everyone's been to an ER at some point, and you get there and you see the nurse, and the nurse can do certain things, they can do certain things, but ultimately, like you have to go to the end of the road, which is a physician, where they do that end of road, like they order the exams and do all these different stuff. Doesn't mean that the nurses are less important in this whole wheel because and so I think the same thing with mental health. Doesn't mean that a therapist or a counselor or a PsyD or anybody else it's just a different scope. So if you need to go to the end of the road, like if you need medication, if you need some physical, like the what are those things they put on their head to do um some sort of, so like if you need any more advanced therapies, you need
Oh,
to see.
like an ECT or TMS.
Yeah, yeah. And so you just need that end of it. So I think you just have to know, and also part of it also as a psychiatrist or physician, you're kind of like a leader and you have all these opportunities to take a leadership role. Doesn't mean that you won't have those under any other things, but you're just gonna have to decide, do you want to spend that extra 10 years to have that tool bag to be able to do all those extra things? Or you may just be happy being a therapist, and there's nothing wrong with that. And or like a counselor, or mental health, or society, and anything of those things. Those things still take time. It doesn't mean that it's less time. It's less time, of course, but it's still some time. Like for example, in California, if you want to be a a social worker, MFT, you have to do like I think a couple thousand hours
Mhm.
of of and then most of it is not paid. Where in residency, you get paid pretty decently. Not You're not going to be a millionaire. You're not going to be a tech millionaire being a psychiatrist, but you could make a good living and be able to survive. So, and I think it has to do with all these other careers. There is, not everybody needs to be a physician. I mean, we had a panel of physician assistant yesterday, and all of them said like we didn't want to be in school for 10 years, and we were okay with that decision. Or and yeah, and so everybody makes those kind of decisions. It's what you want to know and not what other people have expectations. And what's going to make you happy at the end of the day? Because if you don't like taking tests and going to school, like being a physician is not recommended. But um, how do you know if you need a therapist or a psychiatrist?
So I would say different reasons. You might not actually know the answer to whether you need a psychiatrist and you might need to go to a therapist first, but that's okay. I think it's a severity question that you might not be able to answer on your own. So if you notice that you feel, so there are different diagnoses, right? Like let's just talk about anxiety and depression, but I'll give you some other stuff. But depression would be change in mood or change in interest in stuff for like a pretty like it's up to 2 weeks. But if you feel like it's interfering with your day-to-day life or you feel like it's getting worse, that would be a reason to ask for help. Therapy, I think sometimes too, you might go because you're mad at a friend, you had a test you need to work out, you had a like whatever life stressor that in the moment you're just like, this is feeling a bit overwhelming and I don't know how to deal with it. That can be quite good for that, just to talk about stuff. Um, Anxiety is worry, so persistent worry interferes with your day-to-day life too in that sense. I think the anxiety that causes a lot of physical symptoms and is like preventing you from doing the things you want to be doing is going to land you in a psychiatrist. Anxiety that really is sort of brewing, you have some worries, it's affecting you, but it's not impacting you so badly that you can't go socialize or you can't take tests, you might start in therapy. um, it's hard because it's sort of disorder specific in a lot of ways, but I would say if you are worried about something you experience in your life and want to talk about it, if you don't want to rely on your friends or family for that because you'd rather have an outside perspective, therapy can be really helpful. If any of those symptoms are becoming worse and really interfering with your life and more problematic, you might end up at a psychiatrist or even start at a psychiatrist, but that's okay. If you come to us and we don't think you need meds, we'll send you back to a therapist.
Yeah, and also, Dr. Gold, is it like psychiatrists do less and less psychotherapy? It's because the time, like there's just a time issue, or is that true?
So
The
part of it
time
is,
commitment?
yeah, part of it's insurance reimbursement. It's like the worst thing to have to tell you the answer is. We're reimbursed better for having people who are on meds, and also sort of accessibility. There are more people who can see you to talk to you and way less people who can see you to prescribe. And so insurance plus access were best used at medication. You will see people who do both in their practice. A lot of those folks are in private practice because they're just not dealing with insurance companies. I don't practice like, hey, nice to see you. What med are you on and what are your side effects? Because I don't think that's helpful. But I have 30 minutes to ask you about your life and they'll have 50, right? And so I do ask that stuff though, because to me, like, if life is complicated and hard, I can't just give you a drug to fix it, right?
Right.
Like, that's not the answer. I might tell you that you need more intensive therapy too, and that that'll help. I think also just because of need, I can't see people every week for an hour, right? I can see people once a month or once every 3 to 4 weeks for 30 minutes. And so if you need someone to talk to regularly, or your problem is like significantly more active at the moment, a therapist would be a better choice for that too.
Yeah, I think and this is actually an extension. Could you elaborate, tell us more about our broken mental health system?
Oh
Do you get
man,
two
yes, I
hours?
can. Do you want a novel? I'm trying to think. There's a the former head of the National Institute of Mental Health, Thomas Insel, wrote a really good book about this if you're interested, because he also is really interested in how like sort of over-diagnosing and thinking about things just based on diagnoses has led to like some changes in how we prioritize stuff. But he's a really great, he's smart. His name's Tom Insel. But anyways, the mental
It's
health,
healing our path into.
yeah, that guy. There are lots of steps that it's broken. So accessibility being one. So not enough people for a much intensive growing need. Not enough people you can get into quickly enough, which is also a big thing, right? Like, if you want help, you don't want help in 6 weeks, you want help in a week. That's really hard to find. That's why all those telehealth companies have sort of like popped up to solve that. I would say, in my opinion, they're kind of hit or miss. And some people really like therapists they've found on them. And some people think that they're not good and qualified because they're not paid well enough to be good and qualified. So that's just an issue, but they do help you get in faster. Besides getting in, it's expensive, right? So if you have insurance coverage, maybe it covers it equivalently to physical health, but usually it doesn't, despite that being illegal. So you tend to have better physical health coverage than mental health coverage. Your insurance might also limit who you can see and for what. And maybe you want to see someone who looks like you. Maybe you want to see someone who specializes in something else and they don't cover it. And that's a pain. When it's not, a psychiatrist could be like $400, $500 a session out without insurance. A therapist could be probably like, depends on level of training, like $150 to $300, some places have sliding scales, meaning that they look at how much money you make and they'll adjust as a result, how much you can afford. Schools usually have free people, which is nice. That's usually a good place to start. The mental health system is also broken because, um, you know, we have to do a lot with crisis and can't do a lot for prevention. So, like, if I have a patient that I see an outpatient and you have worsening symptoms, but right now, today, you don't want to end your life, I can't send you to the hospital because you won't get hospitalized. There are intermediate things like intensive outpatient programs and partial hospitalization programs, but they tend to not be covered by insurance or not be as accessible in the country. Like, they're just less of them. And so what tends to happen is someone like me is going to like hold you in office visits as frequent as I'm able to see you, which is probably 2 to 3 weeks if I'm pushing it, right? So every 2 to 3 weeks, I'm like, please still be okay. And if you're not, then I send you to the hospital. So those are your two options. You see me irregularly, or you go to the hospital. And then the hospital really just like stabilizes you for a day and sends you out, right? Like, that's the thing. Like, the hospital is also it saves lives in the moment, but it's not like fixing what the problems were. And so that's also problematic too. I mean, I think you could read if interested in sort of like the history of deinstitutionalization in this country. But we had institutions in like the 70s, a lot more of them. We still have long patient stays, but not as many and not as many places. They were shut down because of human rights abuses in a lot of ways instead of like reformed, and shut down by a president. And then another president took over and didn't expand community care. And so they shut down all of those places, but in the meantime, didn't then give all those people a way to be supported by care. So if you're on Medicaid, there's one clinic you can go to probably. And that's not great. If you're a person who doesn't have insight to the fact that they have a psychotic illness because of psychosis, like you have schizophrenia, you probably will stop taking your meds and getting your meds. And it's pretty hard to qualify to be able to get someone to help you, and also pretty hard to ever get to the point. And only a few states have a place where you would actually have your medications like outpatient forced on you because you didn't know. Not, aggressively, but in a way that you stay on them. So that's like psych 101 in 10 minutes. But, there's lots, like if you want to read about deinstitutionalization, that's a good like area to think about reading about if you're interested in it. I don't know who's written a good book on it because I don't remember. Oh, the NAMI folks have two good books that I could find pretty quickly.
I could find it.
Yeah, they have two books. One's for like caregivers, and one was written for like you trying to navigate the system yourself, like what questions you ask and all that stuff. And that's a pretty good book too. It's called You Are Not Alone. I think that's a good book if you're like, what's up with mental health and what's the deal there? That being said, though, I mean, I do think, people are thinking about this and trying, but a lot of it is like sort of systems overlapping systems, like a lot of healthcare.
And I feel like one of the main factors contributing to mental health for both pre-meds and healthcare workers has to do with profit-oriented of the whole healthcare industry, meaning, for example, that residency spots are kept artificially low and admissions are unnecessarily competitive while patients and nurses are subject to unsafe staffing ratios. Would you agree? That would you suggest what to be done about it? That's a
I would
that's a
say,
3 hour talk, but
yeah,
yes.
again, you're giving me big questions. I mean, I would say that psych doesn't make money. The only way that psych exists in academic medical centers is places like orthopedic surgery and neurosurgery give us their excess money. That is the same with ER, right? These places that are mostly seeing uninsured people and reimbursement rates are super low are always in the red. If people had choices, we wouldn't exist in hospitals because of that, because we make no money. They have no choice though, because of how much like what's going on in someone's mental health leads to people like spending the hospital's money. And so they end up like sort of choosing to invest in it anyway. But, inherently the profit that comes from mental health is not the point, but the profit of the whole system is problematic. Insurance in general is pretty challenging around a lot of things. Like I would sometimes we would have a patient who was admitted to medicine that needed to transfer to psych, and their medicine and psych insurances were different, and they have to leave that hospital. That's stupid. They were just in that hospital. There's notes all over from them in the hospital. But because we separated medicine and psych, and you have two insurances, and we didn't integrate them, which by the way also led to stigma and also led to people like thinking that mental health isn't health because it's a separate insurance. It's like dentistry, right? Like it's the same. It's your teeth and your brain, in your eyes. But because of that can be pretty problematic too in the for-profit side. In terms of admissions, I have a big problem with the fact that like we take people into med school and they don't match. Like that is stupid. It is really hard to get into medical school. It is very bad for their mental health, all like to not match. And it doesn't make any sense. If we can't like get people into being doctors from med school, that process is not done right. And the process is done by a computer too, which has its own like why are we trusting we've been trusting AI for with our lives for forever. But you know, I think that that is a big issue too. I think there's advocacy, especially in psych, to try to get more spaces where we can in programs, but it's complicated. There's also things like intimacy, as well as other states sort of like trying to find ways for international medical grads to not have to do like 75 hoops, including all of our step exams and repeating residency to be able to practice in states that don't have enough access, right? So you have to kind of think around like how do you support different levels of care for folks and how do you like encourage people to live in states that they might not be as excited to, and things like that help. So I do think we have to be creative in order to like, you know, accurately sort of build like a mental health system that can help everybody who needs it.
Yeah, no, I would just add that the residency spots are kept low. It's not because so Medicare pays for almost half of the paycheck of a resident in the US. And the problem is because of the Balance Act of 1996, I think. Yeah, 95, 94, 96. The same amount of money that goes into residency for the last 28 to 30 years has been the same. So that's never increased. And so our population has increased significantly, for 30 years, but our residency spots have not. And until, that is increased, some hospitals have expanded residency spots, but they're going to have to take it from their profits or whatever money that they do, and running a hospital is a pretty expensive thing. Bottom line is that I think these are all really great questions. And for me, what I always tell people is that these are not systematic. The systematic issues are not because we can't do it, but it's because there's no political will. And until more people get involved in the advocacy part of it, from elections to lobbying to all of these different things, we're still going to sit around and talk about this 30 years from now. And I think that's the problem. And I think we're seeing more physicians and healthcare workers involved in the process. Like I worked for a lobbyist for a bit, and the most powerful thing is when you get healthcare workers show up in their white coats or scrubs to lobby their legislators, because I could tell you this right now, they will listen to them, and you get meetings and they'll listen to you, but they also you bring in that lived experience. So that's why, like in California, the most powerful unions are the physicians and the nurses. Like pretty much in California, if the nurses want something in the state, like ratios or staffing, all of those things, it happens because they've defeated like people running for governor and other stuff. And so that's the political will. I think in this country we don't have the political will. It's because it's easier for us to get tuned out and say, oh, I don't like politics. And I'll say, well, okay, you may not like politics, but you know who likes politics? The CEO of the insurance company, the CEO of the hospital, the employee that doesn't want to get better insurance for its employer who doesn't want to get better insurance for its employees, your landlord, your power company, your oil company, those they love politics and they're involved in it. And so if you as a young person, you're like, oh man, I can't really do, yes, you can. Go work at a local election. Go work at your local congressman or state legislator's office. There's a lot of things that you can do with your time, and 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 so and I think the favorite quote by Gandhi is, "Be the change you want to see in the world." We could all be depressed about it and throw our hands in the air, but there's things that could be done, and it's because of lack of political will. This person has another question or comment, is that they used to work as a sitter in a hospital and saw firsthand the conditions of a psych hold many times. And while I understand the need for safety, I don't see the high environment that is conductive to healing at all when you're in a crisis. And I wish there was more to make it more tolerable. You,
Yes. I mean, I understand why it's a comment, not a question. I mean, I think that we have a lot of trouble sometimes with people with training because first years and second year honestly are pretty hospital based psych, and you don't see people get better. You see a lot of people coming in and out and in and out and in and out, and sort of like really it's not uplifting. You just see all the ways the system is not helping them. Because of this, a lot of psychiatry residency programs have tried to find ways to get you long-term therapy patients and access to outpatient earlier, because it's really hard to not have that balance. You might end up liking inpatient because people do, but I think like that's part of it, is that like system is really hard. I think that it's as healing as it's been able to be, but I think like, some places have done a lot better in terms of use of like the inside space and outside space to make it healing for folks. I've seen a lot better ones. Europe has like some better ones because of that too. But they're not intended to be long-term stays either. Like insurance wouldn't let it. So it's kind of hard to know what the balance there is. I had to reframe it in my mind to basically be like, oh, we just basically are, making sure people are alive. And that's what we do in the inpatient and give them a place to be. And there's a lot of data that it does help with that, but it is hard.
yeah, I think once you're in an inpatient setting that you need a sitter, like you're in a crisis. It's not a it's not something that anybody wants to, but it's a safety issue, but also like something has gone really wrong that that needs to be done. So yeah, somebody wanted to see the four colors of illness. We'll post your PowerPoint presentation on the page, but since this person
And you
wanted
said, when's it a good time to see a therapist? I mean, like if you're a person that it helps with your life, you can go and you can afford it or you have access. I would say whenever, but really for sure about the yellow or yellow turning orange are probably the best times. There will be some people who like some kinds of therapy that are really good in the orange, like dialectical behavioral therapy is pretty good at like kind of heightened emotional need. But I would say for the most part, red, you're going to end up seeing psych, but you might see psych plus therapy because all the evidence says like meds plus therapy are better than either alone for people who are really struggling. So you might end up being told to do both. And that's why.
this person wanted to know more people that have trouble concentrating, not necessarily being
Yeah,
ADHD. Um,
for
wait,
sure.
could could you say more about trouble concentrating, not necessarily being ADHD? Can someone who has ADHD be a good doctor?
The answer to your last question is absolutely. I see so many people with ADHD who are good doctors. It's just that like I would say the things that are hard are if you have a shifting schedule, making like taking meds at the right point and not messing up your sleep can be pretty hard. And like that's something to get used to. And I would say there are lots of sort of like changing things and like executive functioning to manage that like you can get behind on things like notes. You just have to kind of know that, but by the time you're in medicine you probably already were dealing with that in college and have some awareness. If you get diagnosed later, which I've done in people, it's just like you also have to learn skills at the same time, and it's okay. But they're great doctors and nurses and everyone else in healthcare. The hardest thing being shifts. When I said concentration is not necessarily ADHD, so concentration is a symptom. There's a lot more going on with ADHD than just concentration. If you read the like sort of long-standing diagnostic like evaluation of ADHD, you're supposed to have symptoms before the age of like 10 or 12, something like that. Don't quote me on the exact age, but it's elementary school. And as a result, you We don't have a definition for adult onset ADHD. I think that a lot of people get diagnosed as adults because they had symptoms that weren't as recognizable as a kid. Women and people of color are less likely to be diagnosed in school. So sometimes you just didn't notice. Sometimes it doesn't come out until like college because all of a sudden, like you don't have somebody else sort of like getting you your stuff and saying like, hey, did you remember your prescription, or hey, did you pack your lunch, or right, and you just kind of have to do a lot on your own and it can get diagnosed then. But as a symptom, just having trouble concentrating could be for lots of reasons, and it doesn't, like ADHD is one of them, but you would have to have all those other things too. A lot of people watch TikTok videos and think that everyone who struggles with concentration has ADHD because that's what they tell you on TikTok videos. But if you struggle with your concentration, you could have poor sleep, you could have sleep apnea, you could have depression because it's a symptom of depression to have poor concentration. You could be anxious because if you're anxious, you can't concentrate. It can look very different. I mean, it's hard for you to understand how it can look really different, I think. But for me, like if you're anxious and you can't concentrate, when you go to concentrate, you're like thinking about the 75 other things you should be doing and that you need to be doing. If you have ADHD and you can't concentrate, you're usually like squirrel, noise, like, right? You're like just kind of all over the place in what you're paying attention to. It has nothing to do with the worries that are distracting. That being said, that's why, like, if you have concerns, bringing that into like a psychiatrist can be helpful because we can walk through the rest of the concerns too and actually help you know what's going on.
I would just say TikTok is the worst place to get diagnosed for anything because, yeah. Anyways, yeah, because I've had a couple people say, "Oh, I saw this on TikTok." It's like, no, it's a more complicated thing than just a 30-second video.
Yeah.
Do psychiatrists practice psychoanalysis?
They can. So
This,
it's a psychoanalysis. It's like what Freud did. There's bed, like a couch. Sorry, I said bed. That is some Freudian slip. There's a couch, and you like don't talk a lot, and you go every day, and it's pretty intense. We don't learn it in training. You can go to a school that has psychoanalysis like as a certificate, and like some people do that. I would say it's more common on the coasts than it is in the middle. But it is a thing that you can do as a psychiatrist. You can also do it, I think, as a psychologist, but you just have to, you go through another set of training and classes because we don't learn it.
is that like a residency or fellowship?
It's neither. It's like you could be in residency and go to the classes at night. It's like a certificate program,
Okay.
if that makes sense to folks. It's a little confusing.
I was not aware of that.
Yep. There's like, like San Francisco School of Psychoanalysis, and you like go there and you get some classes. You can
Hmm,
also just take classes to learn and see if you like it. You don't have to take it to be like certified or whatever.
did not know that. As someone who has a passion for content creation and social media, how do you think we can effectively integrate social media in medicine, healthcare in a progressive, engaging, and an accurate manner?
I'm glad you like it. I think it's necessary because if we don't do it, someone else is going to do it, and they're going to use like titles that make them sound like they're supposed to be doing it. So, therapist, right? Like you can look on social, and those people, there's lots of degrees, obviously, that can let you call yourself a therapist, but also you'll see people using it that are coaches. You'll see people using it that have like one class in mindfulness or something, and they, even if you dig deep, you'll find it, but they use our titles, and even people who actually have our titles like Dr. Oz or something use our titles to do bad things, right? So I think social media is like a really important place for us to be, especially if you like it already. If you hate it, don't worry about it, but is really important to do. It takes time, and it definitely isn't something you can just kind of flippantly do, so you do probably need to find like you probably do need like help in order to like, you need to balance it into your day. You can't just kind of randomly do it. When I like, for me, I started doing it, I started doing Twitter in the end of med school, but really in residency, to share the things I was writing. And as I learned more and shared more and saw what people did successfully, that's how my platform kind of grew. I figured out like having a private one and having a public one was unhelpful because I felt like I was like, this is me and this is Dr. Me and these are different. And like I didn't like that. So I combined them. But I think that there's a lot of important things to do, like in order to like that a lot of gaps that you can address by being on social. There's not a lot of psychiatrists on social for sure. If you go to med school, like there's like, I don't know, a couple, like 10, like probably a handful to 10 of us who have decent sized followings that do what we do. And I think it's also important for people to just know that we exist. Like for me, there's a whole campaign from the American Psychiatric Association this year that we've been helping with, which is like, what is psychiatry? And it's through their accounts. And it's like, how is a psychiatrist not a psychologist? And what do you do for training? And what does your day look like? And stuff like that, where it feels like basic, but nobody knows it. And it's going to probably end up having more views than their annual meeting does, which is a lot because they don't have good social like that. And the annual meeting has like thousands of people there, like live posting and stuff. And so I think it's just important to know that there's a lot of hunger for the information too.
Just a question. Why is psychoanalysis more common on the coast? Also, I'm assuming that there are many other paths that psychiatrists can take. What are they and how did you choose yours?
I think it's more common on the coast due to sort of the evolution of like psychotherapeutic thought on the coasts. They've kind of hung on to like as much psychotherapy as possible, while a lot of other people have gone to the biologic route. There's an intellectual sort of highbrow component of psychoanalysis and cost to it that for some reason has been like people in New York really like it and people in San Francisco and LA really like it, but it's not the choice like for somebody in Memphis. And yes, lots of past psychiatrists can take. So I didn't do a fellowship. I went right into work. I didn't want to do a fellowship, but you can do a fellowship in things like consult psychiatry. Like if you want to do more of the hospital-based consults, you can do a fellowship in child and adolescent. That's probably the most common fellowship for us. We're not like one of those like specialties where everyone does a fellowship, like internal medicine in a lot of ways has become that. But we have certain ones that are more common if you want to do them. So you can what's called fast track into child and adolescent and apply as a third year instead of fourth year. And then it's 5 years instead of 6. A lot of people do that because otherwise you only get 1 month really of exposure to child. And so you can't actually take care of children. You can do forensic psychiatry where you evaluate in prisons and court cases. That's an extra fellowship because we have to learn it in residency, but you only do like one class and one case and you would never be hired for that. And so you do a whole year of like cases. They're all most fellowships except for child and adolescent, which is 2 years unless you fast track, are 1 year. Addiction is also a fellowship through psychiatry. It's also one through medicine, but that if you want more exposure to Suboxone and methadone, so, like they still also have a way to kind of grandfather into that based on hours. But I picked it based on patient populations that I care about. So I've always liked college students and healthcare workers. So I was always going to do that. And I didn't need a fellowship for that. The other stuff, I always wanted to be in academics because I wanted to teach, I wanted to do research, and I wanted to write too, right? It just allows you to have capacity to do all of that. My career has evolved to where I'm basically 80-20 maybe, 20 being clinic and 80 being the chief wellness officer administrative role. If you would have asked me when I was in college if I was going to be a chief wellness officer, I would have said no, because it didn't exist. But also I didn't know I would want to do something like that. But I really like the system. Like my brain works really well thinking about systems, and otherwise I just really get frustrated. Like I just want to fix them, but I can't fix them. And that's just a big pain. And so I've learned that if you are like that, being then able to go into a position where you might actually be able to fix them is much nicer than just being frustrated. And so that has fit me really well.
Yeah, this is a really good website that you could look at the various areas of psychiatry and um, what's fellowship and residency and um, yeah, we're gonna do the book away in a minute towards the end of it because I wanna when I do it I want to stop recordings. Some people may not want their names on the internet, um, so yeah, so as soon as we're done with all the questions, we'll do the book giveaway. So
Amazing.
don't leave because if you leave and we pick your name, there's no way that I could get your I'm gonna
Ooh.
ask you to email me so I could send it to you. We get your
And that's
address.
nice. I'm glad you saw me on the news. Hopefully I did a good job.
So what's the biggest show you've been on?
Uh, Good Morning America, probably. I've done MSNBC too. Does that count?
Depends whose show.
On MSNBC.
Yeah.
What's that guy's name? I'm not gonna remember. Oh, and Katie Tur is one of them, but I can't remember the other one. I did two. It's hard to make people interested in healthcare worker mental health. Mental health is also often seen as a less time sensitive topic. And so sometimes I'll get asked to do stuff and then it gets punted for like 3 years. NPR, I've done a lot of NPR and a lot of quotes in the New York Times. So
Which
like
NPR shows? Terry Gross?
I haven't done that. If I'm lucky, I'll get something like that eventually. A lot of like Life Kit, 1A, like what else does Ritu have me quoted on? Like some of those like ones with quick segments, like news segments that I'm not gonna remember. Like
Guy Rizal or whatever. Yeah.
I'm bad at knowing because I just say yes when it comes from certain places. So
Yeah, no, I'm a huge NPR nerd.
that's funny. It's always funny to me where people have seen you. Like my patients watch local news more than I thought. Like I don't actually like being on the local news, but I've done it sometimes just because they needed help. And like in St. Louis or something, my patients would always, that would be the only time they'd ever see me on TV. But it would be like, I mean, I was like, I've been doing this stuff for years in other ways. And they're like, we don't watch like those national things. And you're like, oh, okay.
Low information voter slash this is I knew from the work that I did in campaigning. Lower low uh uh lower information voters tend to watch local news and trust local news than national news, which I did not know that. I was really surprised. I was like, what? Everybody watches like the big, but no, most people that are not like, and they trust their local anchors more than they do national anchors. So I did not know that.
Yeah. I mean, and a lot more of my friends listen to NPR than I realized too. Like, I don't know. People don't go around saying like I listen to NPR. But I think it's really fun when you do that stuff and people like say they heard you and you just didn't like you were like, I didn't know you listen to NPR.
Yeah, no, I have no shame in watching NPR. All right, so it's 11:30. I don't think we have any more questions. I just want to stop the recording to do the you know the wheel spin. So all right. Well, thank you, Dr. Gold, for joining us. Really enjoyed your talk.